Hello everyone, welcome to my channel A to Z Nursing Notes. I'm Rupinder and today I will be talking about how to meet the language requirements for CNO. Now you must be thinking that this video is quite similar to my other videos, that is the language requirement for NNAS or the new language proficiency policy as per the CNO, right? But I would like to clarify here that this video is a much more detailed video, as one of my subscriber she asked me that you have already told us that there are different means of meeting the language proficiency as per CNO, but what is the actual step-by-step procedure? So this video is regarding those steps for each of the categories. There were 7 categories by which you can meet your or you can say there were 7 options according to which you can meet your language requirements. So I will be discussing each one of them in detail, right? And I will be telling you which all forms you have to attach in this video. All right, so let's get started. So now, language proficiency, what does the like NNAS or CNO means by language proficiency is that the applicant, he must be able to communicate and comprehend effectively. That is, he must be able to talk effectively and he must be able to understand the meaning effectively in both oral and written English or French, right? Now there are many other subscribers who ask that is there any way that we can just bypass the language requirement? So I must clarify here that the language requirement for registration is a non-exemptable requirement. That is, you have to meet this requirement in the end to get registered as a registered nurse in Ontario or any other province, right? I have told you that you can get your language requirements waived for the NNS process, right? But it is that okay, you do not have to give your IELTS exam so that you are able to pass the NNS process, right? You can keep it exempt from the language requirement during the NNS process. But when you come to the CNO has a list of requirements which you have to meet, all of the requirements, including the language requirements. So it is a non-exemptable requirement. Yes, CNO has made changes in how to meet the language requirement, but it has not exempted it. There are different means by which it has given you more options so that you can qualify for the language requirement to meet the nursing shortage, right? This requirement for registration is non-exemptable and applies to applicants of all classes with the exception of non-practicing class. I've already told you that there are different classes of nurses in Ontario, right? And one of that class is non-practicing class. That is the nurses who are not in practice, currently doing work, right? So those are the only person who are exempt from the language requirement. Apart from that, all the nurses of all the categories, they have to meet the language requirement. So the language requirement is also a requirement for the members of the non-practicing class applying for registration in the general or extended class, right? So as I said that the non-practicing nurses, they are exempt from the language requirement. But CNO is trying, or Ontario is trying to meet the nursing shortages, so they are inviting the nurses who have quit their practice to rejoin the workforce, right? But even when they are trying to rejoin the workforce, they will have to meet the language requirements so that they can practice as a nurse, right? And also the past members applying for the registration in the general or extended class, they are all required to meet the language proficiency requirement. So as I've discussed, there are 7 options. So I will be starting with the most common option, that is the option 1, that is by achieving the required benchmark scores for one of the approved language proficiency tests. This is very well comprehended that you can give either of the language proficiency tests like IELTS, CELBAN, right? And a French exam you can give so that you have to achieve the required band score in one single attempt, and then you can meet the language proficiency requirement, right? And how much is the band requirement for each of the language tests? I've told in my previous video that is the language requirement for NNAS, right? I've given the link of that video in the description box. So the applicants, they have to meet the language proficiency if they have achieved the required benchmark for one of the approved language proficiency tests, and these should be valid. That is, the bench score should be benchmark scores, they should be achieved within the single attempt. Like for all the four, that is speaking, listening, reading, writing, they have to achieve the required band score in one single attempt, and the test should be valid. That means it should be given within the previous 2 years, right? Now next is the applicant who complete a Canadian approved nursing education program in English or French, or completed a nursing program outside Canada delivered in English or French. So this is another way to prove that you are proficient in the language. Means that either if you are somebody who has done your nursing education from Canada, or for the internationally educated nurses, if they have done their bachelor's of nursing or their whichever nursing course, if they have done in English or French, then they can apply for this language proficiency, right? So acceptable programs under this are the nursing programs conducted in Ontario or in another province of Canada or outside of Canada. So for outside of Canada, obviously the CNO will get the evidence from the NNAS from the nursing education form which you send to the NNAS which are being sent to the NNAS by your educational institute, right? So they will clarify that you have been taught in English, you know how to speak English, you can comprehend English very well, both verbally and in writing, right? So that is the second evidence. The evidence must demonstrate, that is your nursing education form which you're submitting to the NNAS, or the other forms which are submitted if you have done your nursing education in Canada. So they should demonstrate that the theory and the academic means of instruction was in English or French. Whether it is completed online or in person, it doesn't matter, but it should be given in English or French. Also, it should have a clinical part which is completed in English or French in the healthcare setting, right? And the third is that the evidence must be completed within the past 2 years, right? So I guess this would be applicable to the applicants who have recently completed their nursing education, that is within the past 2 years when they have applied to the CNO or to the NNAS, right? Next is completing additional nursing education in English or French. This is applicant, in this the applicant must meet the language proficiency requirements where they have completed the additional nursing education in English or French. And the acceptable nursing education courses are that they should be having their, again, clinical theory and academic instruction should be in English or French. Doesn't matter the course is online or in person. And it should contain a clinical clinical part, and it should be completed in a predominantly English or French healthcare setting. That means that you are doing you are working in a hospital, or you are doing your internship in a hospital where the majority of the population is English speaking or French speaking, so that your supervisor or your education institute is able to prove that you are able to communicate and comprehend English or French fluently, right? And it should successful completion of both clinical component and the theoretical component. That is, you must have passed the clinical as well as the theory component. And again, this educational program should have been completed within the past 2 years. For all of the educational requirements, language requirements, the whatever evidence you are providing, it should be within the past 2 years. That is the most common requirement, right? That whatever that your education, it should be recent, right? As it is with the language requirement tests, right? And they should be within the past 2 years. So now when you are showing this your additional education as your language proficiency proof, you have to provide to the CNO the language proficiency request for educational transcript form, right? So this is what is this form, I will show you. And this is the link I have. This is the link where you can find this form, and you will be downloading this form, completing the first part of this form by your putting on your name and your details, and you will be sending this form to your educational institute wherever you have completed your education, right? And they will be sending this form directly to CNO via fax or via email, and I will be discussing this form. So this is when you click on that link, then for this language proficiency request for educational transcript form, you will be getting this kind of form. And you there have been clear instructions for the applicants that the school will be sending this form to CNO along with the copy of your transcript, right? So it is mandatory that just like your nursing education forms, the form should be completed by the educational institute, as well as they will be sending the transcript. Same goes here. The educational institute from where you have completed your additional education, they will be sending this completed form along with the copy of your transcript, right? So here you will be filling your last name, your first name, your date of birth, and your application number. So this can be your RN application number or your RPN application number. And then there is a declaration part, and you will be putting on your signatures and your date. Now this is the next page of this form, and this is there are again clear instructions for the school is that they must attach a transcript, right? And it should be sent to CNO completed by mail in an official, like normal mail, that is post, in an official envelope showing the signature, seal, stamp or logo of the signatory or the organization. If it is being sent by email, it should be sent to the email address enp@cnomail.org, or if it is being sent by fax, so this is the fax number 416-928-6507. So this all information the school will be filling out, right? And they will be sending it to CNO. Now again, as I have told you here, in case the school is sending the information by email or by electronic fax, right? So they should be mentioning that, okay, this is regarding the entry to practice requirement, right? And they will be mentioning your name as well as your application number in the subject. Now coming to the fourth option, the applicants who are or were registered as a nurse in a Canadian jurisdiction. So this is for the nurses who have been working as a nurse but not in Ontario. They were working somewhere else, like in Alberta or Nova Scotia somewhere, right? So they have moved. So they can prove their language proficiency to CNO by showing their previous work experience, right? The applicants are the labor mobility applicants. They will be meeting the requirements in Ontario for a 2-year time frame, right? Then the evidence of must demonstrate that the applicant currently holds registration in another Canadian jurisdiction and was active and practicing category, right? So if you are like a nurse who was working in Alberta and has recently moved to Ontario, so you can show your language proficiency to CNO by simply showing that you held a registration in Alberta and you were in the active and practicing category. If so, language proficiency will be valid for 2 years from the date of signature on the document verifying the applicant's registration status in the Canadian jurisdiction. So whatever proof you are submitting for your registration verification, whatever date is on that document, that from that date your 2-year period will be counted, right? So the applicant held the this especially I think would be applicable in case of like a person who was an RPN and wants to become a RN in Ontario, right? So if they are able to prove get the registered as a RPN in CNO, then they will be able to meet their language requirement for the RN application. The applicant held the registration within the previous 2 years in another Canadian jurisdiction in an active and practicing category. Like if you were not currently working, so you must be at least working within the past 2 years, right? Then your language proficiency will be valid from the 2 years, for 2 years from the earliest of the following 2 dates. Which are these 2 dates? The date on which the applicant's registration in the other Canadian jurisdiction expired or ended, or the date of signature on the document verifying the applicant's registration status in the other Canadian province, right? And the past members of the CNO who held a certificate of registration with the CNO in the general, temporary, special assignment class, emergency assignment class, or extended class, they can also apply under this category, right? So the language proficiency will be valid for 2 years from the date on which the applicant last held the registration in that category, right? And the current members of the non-practicing class seeking registration in the general class or extended class, they can meet the language proficiency by demonstrating if the applicant held the registration with the CNO or in another Canadian jurisdiction in the general class within the previous 2 years, right? So this category is for the nurses who are either worked as a nurse in another Canadian jurisdiction, or are working as a nurse in another Canadian jurisdiction, or the nurses who are not who are in the non-practicing class in CNO itself, and they want to join the workforce, right? Next is the fifth option is the applicant has practice experience as a nurse in a predominantly English or French setting. So this is, I guess, applicable for the nurses who are like from other countries like UK, US, right? So they are having a practice experience as a nurse in a predominantly English or French setting, right? The nurses from Quebec, right? So the applicant meets the language proficiency requirement if evidence is provided for the A category or for the B category, okay? So coming to the A category first, the applicant completes a supervised practice experience in Ontario, right? So as I've told you, I've discussed about the supervised practice experience in Ontario in my video, that is the new language proficiency policy by CNO, right? So in this, the applicant, they will be working in a like institution or organization, and where the primary language spoken in the healthcare setting is English or French, right? And the primary language of the patient population is also English or French, right? And the evidence is of successful completion of this program by the applicant. So there are some specified number of hours, like 140 hours, that the applicant has to complete under the supervised practice experience, and then the supervisor will fill the form on the applicant's behalf and submit it to CNO as an evidence of language proficiency, right? So this is for the applicants who are like applying under the supervised practice experience class. Second is the B category, that is the applicant has practiced as a nurse in a healthcare setting, and registration as a nurse in that jurisdiction is verified. The language spoken in the practice setting is English or French, and the primary language of the patient population is English or French. So I guess this is applicable to the nurses who had previous work experience in in a different state where the primary language is English or French, right? So here the language proficiency can be met for 2 years from the last date when the applicant worked or practiced. The nursing services must be provided in English or French, and the primary language used to communicate with the patient population should be English or French. Practice experience includes clinical and non-clinical. So in this category, it can be like you have worked as a nurse, or you can be working in the support category, but in the healthcare sector, right? Not in any other sector. CNO will consider practice experiences in both paid and volunteer roles. So even if you have done a volunteer role in a healthcare setup, that will also be counted as experience, right? So you do not have to get disheartened that I just had a volunteer experience, or I didn't had a paid job. It doesn't matter. And you are required to submit to CNO the following form, that is the confirmation of language proficiency form. The link is given here, and I will be giving the link of these two forms in the description box also. Next is the sixth option, that is the applicants with the experience working in health services in English or French in Canada. So Applicants can meet the language proficiency where they have the experience providing health or personal support or care services to patients in English or French in Canada. Their language of proficiency is verified by a regulated health professional who works directly with the applicant in the healthcare setting. So it can be any of your colleague or your supervisor. The language proficiency will be met for 2 years from the last date where the applicant has worked or practiced. So the examples of the acceptable evidences include the experience working as a personal support worker, healthcare assistant, continuing care assistant, or a medical office assistant. As I've told you that it can be in the support sector but in the healthcare. But if you have done like some work, or if you have some work experience in the non-health related work experience, it will not be counted, like your experience in the restaurant or the hospitality work, salon, related personal care services, child care or nanny services. These are not being taken into account as an evidence of language proficiency, right? Things to take into account is that there should be interaction with the patient. It is important in this category, and the CNO requires this form, that is the confirmation of language proficiency form. I will be discussing that form in the end. Next is the option 7. The applicant who completes a healthcare or healthcare support program in English or French in Canada. Applicants can meet the language proficiency requirements where the theory or academic instruction was provided in English or French, completed online or in person. There should be a clinical component in that. Again, it should be in the English or French. And the level of proficiency is verified by the regulatory health professional who directly worked with the applicant in the healthcare setting. And the evidence demonstrated that the applicant has met the requirements, that is A and the B part, that is the theory and the clinical part within the past 2 years, right? So it's like it need not to be that earlier we have discussed about the additional nursing education. So apart from that, if you have done some other healthcare program, that is also can be used as an evidence to prove your language proficiency, right? So in this case, the CNO requires your confirmation of language proficiency form as well as your language proficiency request for educational transcript form. So you have to attach both these forms. I have already discussed about the language proficiency request for educational transcript form. So coming to the confirmation of language proficiency, so this form can be sent by the regulated health professional either by fax, that is on this number, that is 416-928-6507, or by email at the email address enp@cnomail.org, right? This is not to be sent by speed post, as a regulated healthcare professional may not be having the stamp or the seal, right? But if it is in collaboration with some other educational requirement, then it may be sent by your supervisor as in the speed post, right, or by mail, regular mail. So in the section 1, instructions for the applicants, this form is to be completed and returned to the CNO by only one regulated healthcare professional, right? So you need not to send multiple people need not to provide the evidence of your language proficiency to CNO. Only one person is required, and this person should have worked with you directly in the healthcare or healthcare support service setting and within the last 2 years, right? So choose your regulated healthcare professional carefully. He should have worked directly with you, and also it should he should have worked with you in the last 2 years, right? So section 1 will be completed by you, your first name, your last name, your CNO application ID, that is your application number, and then the category of application, that is RN, RPN or nurse practitioner, and your date of birth, right? Then section 2 is the instructions for the regulated healthcare professional. So this is about what the points the regulated healthcare professional has to keep in mind, and it has been specified here that to complete this form, expertise in language assessment is not expected. So that they need not it is not that the healthcare professional should have some like majors in English, so that he can like give the evidence of language of practice, right? It is just his responses are based solely on on his or her observation about you, or your ability to communicate in English or French within the practice settings, right? So once the CNO receives this form, it will become a part of your application, and this section is to be completed by the regulated healthcare professional. His first name, last name, his registration number, type of healthcare professional, which category the person belongs to, name of the regulator, like under which regulating agency the person comes under, then the province or the territory, their telephone number and work email address, right? Next is the a set of assessment criteria about the applicant, which the regulated healthcare professional has to fill. So your the applicant's name and application number will come here, and then what evidence is being submitted to demonstrate language proficiency, that is whether it is regarding the education or regarding the employment, right? So whether the person has supervised you in the education sector or in the employment sector. If the evidence is related to education program, please specify whether the applicant completed an in-person clinical area or not. So it is the clinical person practicum, placement or co-op. Which way is the education program the person has, the applicant has completed. Then in which healthcare setting did you work with the applicant, so where you worked together. Name the organization in which you worked with the applicant. What was the applicant's position title, when did you last work with the applicant. Then is in which language is the applicant demonstrating proficiency, this English or French. Then based on these instructions or like what all you have observed about the applicant, based on that the regulated healthcare professional has to tick mark one of these options regarding his reading, about reading English, like efficiency in reading English. The applicant has the ability to read English or French, or the applicant does not have the ability to read English or French. So based on these like reading policies, regulations, standards, reading written instructions by another healthcare provider, reading instructions by a supervisor or instructor, and so on and so forth. The same way follows for the speaking criteria. So they have given a set of checklist based on which the regulated healthcare professional has to specify whether the applicant is able to speak English or French or is not able to speak. And in the same way it is for the writing, and then for the listening and understanding. And then the healthcare professional will be putting on their signature and the date on which they have filled the form. So as I always give some important tips in my videos, so in this also you have to keep in mind that whatever evidence of language proficiency you are demonstrating, this should not be more than 2 years old, right? So this it should be recent, within the 2 years of the registration with the CNO. And you can request an extension of time frame if your evidence of language of proficiency falls outside the normal 2-year time frame. This is like special cases in which there are unforeseen circumstances due to which you are not able to provide any of the options for language proficiency, and you want that the CNO accepts your previous suppose language test results which are beyond the 2-year time frame, right? For this case you will have to contact the registration committee of the CNO, and then they will decide whether they want to accept your language results beyond the 2-year time frame or not, based on whatever explanations you give, right? And I must tell you that these things take time. They are very time consuming and lengthy process. The registration committee may take up to 9 months to give their decision about your application or appeal. So you must start this process at the very beginning when you have started your CNO registration process, right? And that's all for this part of the video. And thank you very much and all the very best. Thank you.